Cameroon has become the first country to roll out a new malaria vaccine. Inoculating young children against the disease spread by mosquitoes is expected to save thousands of lives. Other African countries are planning to bring in the drug this year.
A historic day in the fight against a disease that has killed millions. Cameroon is starting the world's first malaria vaccine program for children, a milestone in the decades-long effort to curb the disease.
This is truly a turning point. We have been working on the malaria vaccine for a very long time. It has taken 30 years. Cameroon is one of the countries where the incidence is highest. So we decided to start there because it's a place where the vaccine can have a huge impact.
The jab will be offered free of charge and systematically to all children under 6 months old. According to the World Health Organization, malaria kills more than 500,000 people every year. 95% of the deaths occur in Africa. The vast majority of the victims are young children under 5 years old.
The malaria vaccines have been shown to reduce clinical malaria cases by more than half in the year after vaccination. And that level of efficacy goes up when the vaccine is provided seasonally. In that case, it prevents about 3/4 or 75% of malaria cases.
Soon, many more children could get vaccinated throughout the continent. The precious serum is on its way to over a dozen African countries, offering a solution that could help contain the disease.
Let's bring in now Dr. Shalom Tchokfe Ndoula. He is the National Immunization Program Manager in Cameroon, and he joins us from the capital. Welcome to the program, and thank you so much for joining us. A historic moment in the fight against one of the world's deadliest diseases. What does this vaccine campaign mean for Cameroon?
Yeah, it is, of course, a historic moment. The introduction into our program, National Immunization Program, means a lot for us. The malaria introduction, the arrival of this vaccine is now completing the package of malaria control with a means of prevention targeting every life cycle of the parasite, and that will really accelerate the elimination of malaria. The introduction means that the vaccine from today will be available in our 42 districts considering the limited dose at global level, but this vaccine will be the vaccine rollout will be scaled to all the 203 districts in the next couple of years.
And how are health officials there ensuring that it's rolled out in the most effective way possible?
We have learned a lot from the COVID-19 vaccine rollout program. We know that the introduction of new vaccine in our country come alongside polemics and skepticism. And we are taking into account that the population needs more information for every public policy for their health. And to ensure that the rollout is done in effective way, we will use the existing national program for immunization to introduce this vaccine. This means that the malaria vaccine will be given alongside other vaccines like measles, yellow fever, and other, where the Cameroon has a long experience of more than 30 years now in implementing this immunization program.
This campaign especially focused on children. How do you personally hope that it will improve children's lives in Cameroon?
Yeah, well, our country is very diverse and very diverse climate that allow the mosquito to live with population. And it is really difficult to eliminate malaria with only one intervention. And targeting children who have to survive several times to get natural immunity is really the best way to accelerate the malaria elimination in our country. The arrival of vaccine really will reduce potentially more than 1/3 of cases, we hope, and death, and that will also alleviate the suffering of population in our country.
There are other vaccines in the works as well. Do you think that we could soon see malaria lose its grim status as one of the world's biggest killers?
It is a great opportunity, but there is a lot to do and invest even more in current strategy going on, like the distribution of bed net, environmental approach alongside the vaccine, the rapid diagnostic and effective treatment for malaria. It is the combination of all these measures that can accelerate really the malaria elimination in Africa. Vaccine is good news. The arrival of vaccine is good news, but he will not be enough to eliminate malaria. That's why we will focus again on what we are doing to reduce the burden of malaria, as our country is one of the 12 countries in the world that bear more than 70% of the global malaria burden.
Dr. Shalom, Tchokfe, and Ndoula from Cameroon's National Immunization Program, thank you so much for joining us.
Thank you very much.